Gastroesophageal reflux disease, commonly known as Gerd, is a digestive disorder that affects millions of people worldwide. In Gerd, stomach acid or contents flow back into the esophagus, the tube connecting your mouth and stomach. This backward movement, called reflux, can cause a range of uncomfortable symptoms. Gerd is more than just occasional heartburn. It's a chronic condition that can significantly impact daily life. Understanding what Gerd is and how it develops is the first step toward effective management. In the next scene, we'll explore the common symptoms that signal this condition. People with Gerd often experience a burning sensation in the chest, commonly known as heartburn. Other symptoms include chest discomfort, a sour or bitter taste in the mouth, regurgitation of food or liquid, and sometimes difficulty swallowing. These symptoms can occur after meals, when lying down, or even during sleep. For some, the discomfort is occasional, but for others, it's persistent and disruptive. Recognizing these symptoms early is important, as untreated Gerd can lead to more serious complications. Next, let's look at why Gerd happens in the first place. Gerd develops mainly due to weakness or dysfunction of the lower esophageal sphincter, a ring of muscle at the bottom of the esophagus. This muscle acts as a valve, preventing stomach contents from flowing backward. When it doesn't close properly, acid and food can escape into the esophagus, causing irritation and symptoms. Factors like obesity, certain foods, smoking, and even stress can contribute to this dysfunction. Understanding the underlying cause helps guide treatment and lifestyle changes. Now, let's discuss a challenging form of Gerd known as refractory Gerd. While many people find relief with medications, some continue to experience symptoms despite treatment. This is called refractory Gerd. In these cases, symptoms like heartburn and regurgitation persist even after taking acid-reducing drugs such as proton pump inhibitors, PPIs. Sometimes, the cause may not be acid reflux at all, but other conditions that mimic Gerd. Identifying refractory Gerd is crucial, as it requires a different approach to diagnosis and management. Next, we'll see how doctors diagnose Gerd and distinguish it from similar conditions. To accurately diagnose Gerd, doctors use several important tests. Endoscopy allows direct visualization of the esophagus to check for inflammation or ulcers. Esophageal manometry measures the muscle function and pressure within the esophagus, helping to identify motility issues. pH monitoring detects abnormal acid exposure, confirming whether acid reflux is present. Esophageal function tests, EFT, further help determine if reflux is truly the cause of symptoms. These diagnostic tools are essential, especially in cases where symptoms persist despite standard treatments. Let's break down these tests further in the next scene. Let's take a closer look at the main diagnostic tools for Gerd. Endoscopy involves inserting a thin, flexible tube with a camera into the esophagus to look for signs of damage. Esophageal manometry uses a special catheter to measure the strength and coordination of esophageal muscles. pH monitoring involves placing a small sensor in the esophagus to track acid levels over 24 hours. Each of these tests provides valuable information, helping doctors tailor treatment to each patient's needs. Accurate diagnosis is the foundation for effective Gerd management. Next, we'll discuss how Gerd is treated and managed. Managing Gerd involves a combination of lifestyle changes and medications. Simple modifications like avoiding spicy foods, losing weight, and elevating the head during sleep can make a big difference. Medications such as proton pump inhibitors, PIs, and other acid-reducing drugs are commonly prescribed to control symptoms. If symptoms persist despite these measures, further evaluation is needed to rule out other causes or complications. In some cases, surgical options like fundoplication may be considered. Let's look at these treatment options in more detail next. A crucial point to remember is that not all persistent reflux symptoms are caused by true acid reflux. Some symptoms may be due to other conditions that mimic GERD. That's why proper diagnostic testing is so important before continuing long-term medication or considering surgery. Accurate diagnosis ensures that patients receive the right treatment and avoid unnecessary interventions. In the final scene, we'll summarize the key takeaways for managing GERD effectively. GERD is a common digestive disorder that can have a significant impact on quality of life. Effective management relies on accurate diagnosis, appropriate use of medications, lifestyle changes, and careful evaluation of cases where symptoms persist. Remember, not every case of persistent heartburn is due to acid reflux, so thorough testing is essential. With the right approach, most people can find relief and prevent complications. Thank you for watching, and take care of your digestive health.